Welcome back to episode 51 of Taking Charge of My Cancer podcast. I have a great guest with me today, Stephanie Provost. So Stephanie became a nurse in 2007 after she got married, moved to Fort Lauderdale, and started working in the NICU. And then after her husband graduated from anesthesia school, they moved here to Gainesville and worked here at UF Shands on the NICU. At the same time, she went back to school for her bachelor's degree in health education and became a certified in neonatal ICU and cross-training in the PACU for pediatrics. When they started their family, she was fortunate to stay home for several years to raise her boys, 11 and 8. During these years, several family members, including her mother, were diagnosed with breast cancer. Both her mom and cousin were treated here at UF by Dr. Lisa Spiguel and seen by physical therapy for lymphedema. It was a stressful and a scary time, but the excellent care and trusting staff of UF Health placed faith and confidence on their cancer journey. It was because of these several diagnoses in her family, that led her to being tested for BRCA. About a year after she had her youngest son, she found out that she had BRCA2 positive. She immediately made the call to the breast center to begin her journey in high-risk care, and was through her family and personal breast cancer experience that she knew her role as a nurse could serve this population or this patient population, that she had the opportunity to be the nurse navigator at the same breast center where her family received their care. She is happy to share her story, and she didn't have the guidance and resources back then as there is now. So that's a great story, Stephanie, and thank you so much for doing this with me, and welcome.
Yes, thank you. Thank you for the nice introduction.
Absolutely. So I kind of already talked a little bit about your journey, but
Yes.
tell me, were you always planning to be a nurse, or you ever thought about doing something different?
Yes, I think I've always been trying to plan to be a nurse. My mom was a nurse. My cousin was a nurse, and it kind of was just I've always grew up with the family of nurses, and that's what I was gonna be. I really never thought of anything else but being a nurse. So yeah, I ended up going to the same nursing school as my mom, as my cousin, and it just kind of was the path that was created for me, and I really loved it.
Awesome. That's so great. So, wow, pediatrics to adults, right?
Yes, that was very different. So I think with nursing, it's such a nice, there's so many different avenues in nursing. Like I said, my very first job was adult neuro medical surgical, and that was not for me. I lasted about 6 months and said, I made the biggest mistake of my life becoming a nurse. I cannot do this. But thankfully, with a lot of mentors that guided me to be like, there are other avenues in nursing, explore them, you'll find your place. So when my husband got into grad school, I found an opportunity to do a nurse internship, and that's how I found the NICU. And I really loved it there. I really loved the patient population and the families, and so I was trained as a neonatal nurse, and that was the bulk of my career. And then when my husband graduated from anesthesia school, got a job here at Shands, and I was able to work at Shands as well and continued on, but also had the opportunity to cross train and do PACU on peds. But it also kind of then dipped my foot back into adults and different, as I needed to take adults. So I kind of had a little bit of everything. And then after I stayed home with my kids, after we had kids, I was able to stay home with them. I was very fortunate for that. But after COVID and my kids went to school full time, I felt like I was really ready to get back into it. So I was able to take an opportunity of part-time, and I did outpatient surgical care in the recovery room at an outpatient here at Shan. So that really got my feet wet again about like, am I really going to be back to work? Is this going to fit into our lifestyle? And so, yeah, I was able to do that. And again, I wanted more. I just kept wanting more. I knew that this was what I, wanted to do. So yeah, that's kind of how it was.
How did the path cross through? Like, I'm going to ask you a little bit about your history from
Yeah.
your BRCA testing, but if we go before that into becoming our nurse navigator, because you're the nurse navigator now for our breast cancer center. So how that went there?
I had no idea what a nurse navigator was. I don't think a lot of people know what a nurse navigator was, but honestly, it was the journey through my mom and my cousin who I learned about the role and how important that role was to them. Both, we're here in Gainesville, but both of my family, both of them lived in Naples. They lived far away. They were coming up here and commuting. So having that point of contact with them, that they felt that they did have a connection to someone and able to go to have questions and answers and help facilitate appointments for traveling, and being able to just guide them in a way that it really made a significant impact. I strongly remember my mom's nurse navigator and how much my mom enjoyed her and just felt connected with her, and really made a difference for my mom's journeys, especially. So, and it was actually, the nurse navigator who opened my cousin's eyes to, she was in her 30s and not married, and she had no idea about fertility, special for, any of that. And it was the nurse navigator who said, you might really want to explore this. And so she was able to learn about that. And so I just felt like it was such a vital resource for both of them that meant so much to them, that it was like, wow, like I would love to do something like that. I would love to make a difference in someone's life and impact them so much. And, kind of that's kind of what made me learn about the nurse navigator.
Will you explain to the audience what is a nurse navigator means?
So a nurse navigator is a resource who is basically their point of contact throughout their cancer journey. My role specifically starts with I'm their first call once they get that cancer diagnosis. They get their cancer diagnosis from who ordered the biopsy, and then I am that first person to help set them up and explain what their journey in the breast center is going to be like. So I help gather all of their imaging, all their pathology, their history, make sure we have everything we need. I help facilitate that first initial appointment with the surgeon and make sure that I have everything that can be a successful and informative appointment for both the patient and the surgeon. And then past that, I help keep track of appointments. It's very overwhelming for patients, and they're given a list of, you need to see this and this and this, and they leave that first appointment blank stared and overwhelmed. And I make it a point to reassure them that I'm here to take that load off of them, to not have to think about where they're going to go next. They're going to be told what to go next. And I keep track of where they need to go, and I follow up on who they need to see and where they need to go. And a lot of times the patients don't even remember that they were supposed to see PT or see their medical oncologist. They don't know. And then it's like, no, remember. And I reiterate, and it's just a lot of just reinforcing and reiterating, and a direct extension to their physicians. And so if they have a question, instead of calling the access center and being on hold forever, they call me directly, and I'll get them the answer, or I'll if I don't have the answer, I'll find it for them. Or provide them with the resource, like, hey, you need to contact this person. And if that doesn't work, call me back, So it's that reassuring thing that in this big world, in this big cancer journey, that they have that one person that can help kind of be the flashlight to guide the way.
And it is so crucial, and it is so sad to know that many centers have somebody like you, right? Somebody who guide them. And you're right, we happen to see these patients, they see you guys, and boom, within 2 weeks they're seeing us. So they already still coming in like, do you know what you're here for? And they're like, no, not really.
No.
And I am sure that you spend an hour and Dr.
Yeah.
talking about the risk of lymphedema for them. And then it's like, no, I'm sure you remember this, and this is the reason. And then we explain again everything, and I'm sure that I reinforce a lot of the things that you teach them to give them a little bit more. Or sometimes they just really start asking tons of questions to us because they already saw you and Dr. Spiguel, and they have 2 weeks of processing, and then they come with a list of questions for me, and I'm like, well, let me see, I'll try to answer in the best possible way, but more likely you have to reach back to you or Dr. Spiguel if it's more specific, surgical questions. So it is, the job that you guys do is unbelievable, and I really appreciate that, just because again, they're just so overwhelmed, and somebody to kind of like really guide them through this, at least the beginning of it, until they go through these treatments. And you've been amazed. I mean, you've been with us for how long now? Like
about I started in May, so 6-7 months now.
Yeah, but has been like really, I only hear great things about you, like
Thank
really
you.
on top of things, and just make sure that they that, you know, sometimes things in the system get hold back and you just
Yeah.
right there to just make sure the patient is not just on this
Yeah.
wait game, being really more anxious because they're just waiting and waiting and waiting.
Yeah. It's a lot of follow through, a lot of follow up, a lot of calls, a lot of just constant follow up. And, you know, a lot of patient, you know, a lot of avoidance is a common coping skill. And so if it's like, if I don't see it or hear it, I don't need to do it. But if you got that one person being like, hey, you've canceled this appointment or you didn't show up to this appointment, you know, and I tell them that I said, if I will be bugging you, if you know, every appointment builds on each other, every appointment, it, you know, is an important step along your journey. If you don't show up, be expecting a call from me. And, you know, so
you were sorry that you met me because I'm gonna be
I
upset.
know. I'm like, I'll find you. We're gonna get through this. And you know, and even I also reassure the patients, a lot of them, you know, when I'm following up on their imaging, and you know, a common, we like to have several years of prior imaging for comparison. And if patients don't have that, they feel like they have to explain to me why. And I stop them. I say, you don't need to explain anything to me. We're here now. And if you have them, great. If not, that's not a deal breaker. You're going to be seen, you know, and I just don't want patients to ever feel that this is their fault, that they should have done this, they should have done that. And so it's a constant reassuring that, you know, it's fine. You know, we're here now, we're going to move on. And so it's a lot of that, and just reassuring them that this is not their fault and we're going to get through it.
Okay, that's great. So tell us a little bit about BRCA. What is BRCA?
So BRCA is the genetic mutation that's that, you know, you put you at a higher risk for specifically breast cancer. Breast cancer, there's ovarian cancer, there's several different ones, but the breast cancer is the highest risk. And so you know, with my family, when we started realizing, you know, it was like over 20 years ago, my aunt had it, and that we didn't know what that was. And then my mom had it. And then we realized that like my grandma had it. I was too young to realize it. And then I had a cousin who had it. And then when she was young, that was when, you know, she was in her early 30s. And then that's when BRCA testing really started coming around, of testing. There has to be a reason, you know, for a young person, you have a lot of family in your, you know. And then my mom got diagnosed again. And then my cousin got diagnosed, and it was like there's something going on there. It's circling around here, and it's way too common. So yeah, the genetic, it's a genetic mutation that predisposes, you know, a person to cancer. And BRCA, there's BRCA1, BRCA2. BRCA2 is higher with the breast cancer. The same as BRCA1, you know, there's ovarian and breast, but yeah, so that's kind of where that was. And if it's aware that, it helps also manage your treatment plan, and it helps manage, you know, making different, it allowed, you know, my mom then the second time around to realize, okay, you know, the first time I had a lumpectomy, now I have this gene it's gonna come back. And so I don't want to do this again. So then that's how she got the double mastectomy. And my cousin, first time she ever had it, when she found out she had it, she's like, I'm not doing this again, and did the double mastectomy. And that's not always an option, you know, or the first line to go to for patients with breast cancer. But if you're at that higher risk, it really changes your treatment plan and surveillance for those patients.
Got you. So you end up having surgery, right?
I did. Yes.
Right.
Yes. And I waited until, you know, my mom knew about it, and it was common in our family, and it was a lot of like, you should. And at the time I had 2 young kids, and I knew what I was going to do. I knew that I would do the prophylactic mastectomy. I knew I would do it, but I didn't want to know until I was ready to take that step. And so I waited until I was like, okay, if it comes back positive, we're going to get this going. And so yes, I found my sister and I were both tested. My sister was tested about 6 months before me, and she's negative. She does not have it. But then when I found out about it, I think it was like the next day, I called or I got in contact with the breast center, the nurse navigator, and said, okay, it's my turn now. Like, here we go. Like, and so, and it was so helpful to be able to have that contact person still to call, and say, remember our family? Here we go. You know?
Yeah.
So again, it rolls back to that nurse navigator, that connection, to the center to be able to be that contact back in there.
Okay.
So,
Would you recommend, like, what is the recommendations usually when you're BRCA positive? Like usually supposed
So
to.
it's high risk screening. So it would be alternating MRI and mammograms. You're getting screening every 6 months to a year. You're getting imaging. So that was an option. It was, you could keep getting imaging for the rest of your life and keep doing that. Or it was and then, or the mastectomy. And then, from here, the imaging is just, I think MRIs every 3 years. But yeah, it's more of high risk. You get a clinical exam every year, and then the imaging for that. So that's kind of how that is. And also because it's higher risk for ovarian, they test your ovaries, ultrasound of the ovaries to make sure, take a look at those, because there's really no screenings for ovarian cancer. That's what they're really looking for. So it's being able to do ultrasounds every 6 months of just visually taking a look at them to see if there's any changes, blood draws for CA-125, seeing if they're, again, that's not a specific, it's just something in the abdomen's going on. And if those numbers change, it might trigger something. But again, there's no specific for ovarian cancer at this time.
Got you. You went through reconstruction?
Mm-hmm.
Okay.
Mm-hmm. Yep. I did the expanders to implants. And so I did 3 months of expansion and went to implants, and yeah, all through UF Health. And I saw the PT, a lot of it was very helpful. And I don't necessarily know how many people know about, I mean, you might be able to answer this better, of patients being able to come and see during that expansion process. I was having a lot of back pain, a lot of just from that muscle expansion. And I think from the curve, I just was kind of curving myself. So I needed to so it was a lot of the kinesio tape, the foam rolling. I mean, I was religious on that stuff, and that, range of motion and all that. And I went religiously from the time I had the mastectomy till I had my reconstruction with those with the expanders, because every time you expanded, it just pulled those muscles again. Just when you were feeling better, it would pull it again. So it played a crucial role for me, for sure.
So we usually try to, so we have the fortunate that because we see the patient so early, right? Pre-op, post-op, we already kind of know what the process is going to be. So we know we see them post-op, and then we know they're going to get expanded. So I make a point. We actually try to do, Dr. Singhol back then, when he used to work here, we almost wanted to kind of write a paper, because what I was doing some manual lymphatic drainage and some soft tissue mobility prior to expansion to just kind of prepare the tissue. And then we did some K-tape, so some kinesio tape.
That's exactly what I had. Yeah.
So we did this K-tape, and then you went to the expansion. So I was trying to facilitate that. And then I don't know if at that point, Stephanie, we ever give you a little paper. We tried to do a little paper where you just write your symptoms after the expansion, because we were trying to see if we can do a randomized trial or something. We ended up not doing anything because it was not that consistent. But that has been helpful. So the K-tape has been helping some patients not necessarily, but definitely the exercise, the posture, the stretching.
Yes.
The facilitation.
I still have my foam roller that I bought from the PT. It's still sitting in here. It's sitting in my room. I walked out of that thing. I'm like, tell me what I need. It's this giant white roll of foam roll. And I had my exercises and my bands, and it was every day I did them. And it really does make such a huge difference.
That makes a difference. So that's exactly what we try to do. I wish we get a little bit more referrals from plastics, because sometimes if this is a BRCA patient like you, right, not necessarily it's a cancer diagnosis. So perhaps we don't see them, right? Because it's lymph nodes. It is not Dr. Spiguel. So maybe the entry is through plastics.
Yeah.
even though she does a mastectomy, but still no a referral because it's not
Yeah.
discussed on tumor board. So so hopefully some of these plastic surgeons and our having some challenges with our plastic surgery department, but hopefully these new docs kind of start know more about, yes, we should
Yeah.
get to see any reconstruction, period,
Absolutely.
no matter what is
Absolutely.
the reason behind it, right? It's
Mhm.
the same scar, the same lack of mobility, the
Yeah.
same tissue.
It's
We
the same process, but without a cancer diagnosis.
exactly. So
So,
definitely makes a big difference when we try to
sure.
really see them before the expansions, like I believe we did with you, and then we usually see them like if you guys are doing really well, then usually about 2-3 weeks post exchange to implants to just make sure
Mhm.
everything is going,
Mhm.
and then usually you guys do really well after.
Yeah. Yeah. Yeah.
So what has been, will you give us 3 valuable tips that you learned about your journey?
Yeah, my journey as a navigator or my journey or as a patient. Okay. Okay. So, as a navigator, I think it's really just realizing in this role, on our end, we see hundreds of patients, but as a patient, this is their one. And so in realizing that, the multiple calls, the repetitive questions are not this is their first time. So taking a lot of patience, a lot of time, and letting the patient know that they are being heard and that they are seen and that their questions are valuable, and not sounding frustrated or annoyed by hearing the same questions because it's the first time for them. So just allowing them to feel all the feels, but hopefully gain some confidence and trust in their team, and reassuring them that they are in good hands, and that, they are a part of their team just as much as, the surgeon or the oncologist are. They are a valuable member of their own medical team. And I always tell the patients, you're the driver. We give you our recommendations and we give you what, is recommended for you, but you ultimately have the choice in your care. Um, so I think that's been, since I've started really learning how important that is for patients. And for me, as like on the patient side, I think really just learning to advocate for myself, and knowing what, staying on, again, not avoiding, and knowing my risks, knowing how risk I am. And yeah, I did the prophylactic mastectomy, but there's always a risk. And so staying up to date in my own health, and staying recognizing that, and being vocal in my own care. I think that is just such an important thing for everybody to be. So yeah.
Okay. How about the most painful lesson?
Hmm. I think, as a patient, is for me personally, is the vulnerability of it. As you can take all these steps to take control over it, but sometimes there's things that you just can't control. And allowing yourself to, kind of sit in that moment, but then control what you can. And so I think, you kind of sit in this. I think an emotional component plays a huge part in a person's recovery and their journey itself. So I think just really focusing on the emotional health and aspect of it is huge. Um, so, but yeah, and then I think as a navigator is just really um staying organized. And I think that's the biggest thing with our huge cancer load, is really staying organized, and allowing, and really keeping track of your patients, and just following through, and making sure that they're getting care somewhere. It doesn't have to be here at UF. And I always say that, we have everyone under the spectrum here, but you don't have to come see everybody. You can see who you want to see. And if a patient says they're going to go elsewhere, you don't need to explain to me why. I'm just happy you're getting care. And I reassure that. And so, I think that's just important to know that their opinions and their choices are very valuable in their own care.
That's absolutely right. You mentioned a little bit about, the anxiety and the mental health. Is
Mhm.
any tips you have for patients with breast cancer in how to manage that kind of,
Yeah,
the
I
fear,
think,
the fear?
I think allowing, I think we have the resources. We have our nutritionists who can help provide. I think nutrition plays a huge role in your health and being able to fuel your body to have the energy, because patients who are going through surgery, their body is kicked into overdrive with the medicines, with the surgery. They're healing, they're trying to fight this. So being able to, you know, fuel their body with the nutrition to heal, allowing them, setting them up with an exercise, encourage physical activity. Again, just getting out and walking, even if it's down your driveway, down in the hallway, just somewhere, get out in the sun. I think just not sitting inside and feeling sad for yourself, like take control of what you can, walk around, feel the movement, be a part of your own care plan. I think that allows, it takes, I think, and also I think allowing of the knowing, not sitting around and waiting. I encourage questions. Call me anytime you have a question. I think a lot of times if they have these questions and they're not unanswered, you sit and you stew on it and you worry. And I say, anytime, send me a MyChart message, call me, ask me a question. I don't mind being that release of, like, even if it's nothing's too silly or nothing's too small to ask me. If it's going to make you feel better knowing this or that, I think that's a very big aspect in it.
That's excellent. That's very good. How can people get a hold of you?
Well, we have, I work for the cancer center. So in our cancer center, the nurse navigation team, we have, you can find my information on the UF Health Breast Center website. I'm listed on there. We also have, we're launching soon a nurse navigation website. So it'll have the all nurse navigators under the UF Health. So you can find me there. You can call our clinical office. I have a phone number. It's 352-594-7900, and that'll get you to our nurse navigation office. And I am the breast nurse navigator, so you'll be able to be connected to me there. But
Perfect.
yeah, I'm just,
Yeah, and I will have all that information on the show notes, so you have that. So we'll have that. Will be a book that you would recommend for the audience and why?
sure. Particularly for women, I found, even as throughout my journey, of motherhood and being a woman, and through my journey, of BRCA and the mastectomy, I found a lot of confidence there's two books. One of them was The Confident Mother by Joyce Meyer. That helped me through my motherhood journey of, just dealing with that transition. And then there's a great one called The Confident Woman that allows, that really just kind of highlights and gives confidence to women to know, like, the journeys that we as women go through in life. And it's a devotional book, but it's a very good feel good book, and it's one that you can just kind of pick up and read and really find something to relate to. I love those books. I keep them on my nightstand and just kind of read through them and just kind of know I'm not alone in this journey. There's a lot of us that feel this way. So those have been two really good books. I've gifted them to my mom too, and I feel like that it's just a good book to have.
Awesome. I'm gonna check into those.
Yeah.
How about movies?
Movies. I love an old classics. I'm a big, like, Julia Roberts fan, so I love those types of movies that, Steel Magnolias is probably my favorite movie. I can quote every line, and my sister always makes fun of me and tells me to stop, but it's just one of those things. Yeah, those are kind of the movies that I really like. Just the old classic movies.
I do. How about podcasts?
Podcast. I am a big crime show podcast person. I would say my favorite one is probably Crime Junkie. I have a habit. I love walking my dogs and listening to it. It probably freaks me out a little bit. I'm always looking over my shoulder of this and that. But you know, we got to be aware, and I love them. I love a good crime podcast.
Okay.
So.
Excellent. It is one question that you wish I would have asked you and what you have answered.
Oh, that's a good one. Let's see. I would say maybe kind of how I would like to even grow my role as a nurse navigator. I feel like there's still a lot of room for growth for myself and to be able to really provide more support and information through my own personal journey to our patients. You know, it's not something I go and say, oh, I've had this done too. You know, it's not something that, but I will talk to patients as I see who, you know, we can really relate to and feel who are open to that information, but to really put forth some of my personal experiences and help, you know, continue to help patients through my personal experience. You know, we see a lot of, I don't see a lot of the high risk patients, but I have, you know, I would like to be able to do that, go meet these new patients who have just been diagnosed with BRCA. The same, you know, I go and meet the patients who've just been diagnosed with cancer. So I would love to be able to go and meet these new patients who have just been diagnosed with BRCA, who went through the exact same journey that I was getting ready. You know, they're about to go through the same journey that I'm about to go through. So that would be something I would like to maybe implement into my role, something like that.
It is a nurse navigator who does that or not?
No, there's no nurse navigator who sees any of the high risk non-cancer patients, but they are seen in clinic either by the surgeons or by the PAs. But you know, if time allows, I would love to be able to just go in and meet them and be able to be open to a conversation with them, answer questions and things like that.
That's a great idea because I think that, again, it's a little bit different because we're talking about cancer, right?
Right.
But that entail a lot more treatments and a different
Yeah.
medicine. But
Yeah.
again, it is not an easy task either, going from what you went through either,
Right.
right?
Right. I always say it was the easiest, hardest decision I've ever made for myself.
Yes.
You
Yes.
know, it was, yeah. It
Yeah.
wasn't easy to make a decision where there was really essentially nothing wrong and to make that decision to do it. But I felt that it was a way to take control over something instead of waiting for something to happen.
Exactly. Exactly.
It gives you more power. And again, I think the mentality of it all really was different versus, you know, kind of how I saw my journey versus my mom and cousins who had cancer and how they saw their journey. We all went through the same thing, but our paths were all totally different. And again, the mindset was totally different.
And I just can only imagine you being proactive, taking care of something before it happens, and not being on the fear of, now I have something that perhaps can kill me if this
Right.
is really aggressive, right? And you never know. So
yeah.
Would you tell me a little bit about your boys? Would you be tested and what?
Yeah, you know, that's something that you know, in the beginning I thought about, but I haven't. It's like, you know, I don't know. I don't know what we'll do about that. It's something that we talk about. I mean, they were young, but they remember everything that we, you know, my youngest, not so much. He was pretty young. My older one does remember vaguely about it. And so I'm open about it and kind of what it is. And, you know, I haven't thought about it. And I think that might be something that I definitely want to educate them on and let them make that choice if they decide to do that. Yeah.
Yeah, I think it's important. I used to for a little while when I started doing oncology, thinking that males didn't have to worry about it.
No, they absolutely do.
Until I was Dr. Spiguel who actually taught me that. And then it's like, no, actually you do as well, because again, it is not that much.
Yeah, for males, it's more of the what is it? I can't remember what it was, but is it, I think prostate for males? I can't really remember, but yeah, it was and so once my family started finding out, my mom's siblings started testing before they started testing the kids. Some of the kids didn't, well, my uncle, my cousin wanted to test. But my uncle said, no, let me test first. And if I do, then we'll kind of go through the line here. And he didn't have it. So, it kind of, I think it was a big family moment of like, okay, my mom's one of 9.
Oh, wow.
So yeah. So, I'm trying to think, I think 1, 2, 3, 4 of them that we know of carried it.
Okay.
So it was very high in my family, very high. Yeah.
Have you been, so you, again, they're too young, but in the future, would you just kind of maybe go through a genetic testing, not genetic.
Yeah, I know. I haven't really thought about that just yet. I
Okay.
haven't really crossed that bridge.
Yeah.
I think I would maybe allow them to make that decision, I think, and see, definitely educate them on it. I think that's the most important thing. I think our genetic counseling sessions that we have it really taught me a lot. They wouldn't even test. I had to sit and watch a video. I sat with, I believe it was Lisa Brown, and she answered all the questions. And it's very informative. They want you very informed before you get tested. And I think that's a great resource that we have. We're so lucky to have these amazing genetic counselors to reach out to patients and answer all their questions for them.
You know if this genetic testing is covered by insurance, and you don't know that.
Most insurance does cover it, but it's not a high out-of-pocket cost. It's a common question I get a lot from patients. But I think when I was told that the majority of insurances do cover it, and then out of pocket, I think if for some random reason it's no more than $200, I think, of coverage.
Very reasonable.
Yeah, so it's reasonable to have this information for sure.
Okay, perfect. Oh my God, it has been super informative.
Thank
thank you
you.
so much. I think that our audiences really learn a lot from you today. I really appreciate you taking the time to really share your story and
Sure.
share all your expertise with us. I really appreciate it.
Thank you. I'm still learning too. So it's a big learning curve and a long journey, but I'm learning a lot every day with a great team, a very helpful team and very resourceful team. I feel very, very lucky to be here.
Yeah, no, we're lucky to have you here. And again, you've been amazing. Like it's like the communication, like when we, see in tumor board every week, and it's like you're on top of things, like this patient needs to get in, boom, this happens. So it's
Thank you.
such
It's all about being organized.
yes, that's amazing. That's great. And I'm sure that, we're really enjoying that because that's what our patient needs. So,
Yeah.
thank you so much.
Thank
Again,
you.
Stephanie, and you have a great evening, okay?
Thank you. You too.
Bye.